Hello, my name is Steffen Lewis. I've been a critical care registered nurse for 7 years, and I'm currently a Doctor of Nursing practice student specializing in nurse anesthesiology. Today, I serve as an health aide to Governor Asa Hutchinson to elect for CMS opt-out to remove CRNA practice barriers and improve access to anesthesia services across Arkansas. Governor Hutchinson, as you know, we've had the pleasure to discuss CRNA practice and the impact that they provide across the Arkansas healthcare system. This presentation will reiterate key facts about the nurse anesthesia profession and the next step in legislation, which is for you to elect to opt out of CMS federal requirements regarding supervision for CRNA. Before we get into how CRNAs are the answer to increasing access to care, just want to remind you that CRNAs are highly educated anesthesia experts. They are able to administer anesthesia to any patient, anytime, in any healthcare setting where anesthesia is required. There is no difference in safety between CRNAs and anesthesiologists. CRNAs are advanced practice registered nurses who have a background in critical care nursing prior to entering anesthesia school. On average, CRNAs have well over 9,000 clinical training hours prior to becoming licensed providers. All CRNAs are board certified to practice anesthesia. It is no secret that access to healthcare is still a huge problem within our Arkansas healthcare system. By eliminating CRNA practice barriers through opting out of CMS federal supervision requirements, CRNAs are the solution to increasing access to anesthesia services, facilitating increased access to surgical services across the state. As you may remember, CRNAs are responsible for delivering 90% of anesthetics to our rural communities across the state. House Bill 1198, which you signed into law back in 2021, removed supervision language from our state legislature regarding CRNA practice. It is time that we remove federal supervision. As you can see from the map, our critical access hospitals and rural facilities comprise the majority of our healthcare system in Arkansas. Opting out of CMS federal supervision requirements for CRNAs is more of a billing issue and not a practice issue. This just helps these facilities meet the condition by not having a physician anesthesiologist where independent CRNAs are already providing. As you can see from this map, the rising cost of healthcare is contributing to the closure of rural hospitals across the southern region. By opting out, these facilities will no longer require to hire a physician anesthesiologist and can utilize the most cost-effective anesthesia provider, which is CRNAs, that are already there providing the anesthesia. A study published in Nursing Economics showed that CRNAs disproportionately serve rural areas. Compared to anesthesiologists, CRNAs are more likely to be found in counties where populations have lower median incomes, but also where unemployment, the uninsured, and Medicaid are more densely populated. CRNAs provide anesthesia to these vulnerable. With the passage of House Bill 1198, CRNAs can now practice at the full scope in Arkansas. It is time to eliminate the inconsistency between state and federal law and allow the state and local facilities to regulate practice in a manner that is in best interest of the Arkansas citizens. And opting out does just that. There is confusion among surgeons and facility administrators regarding the meaning of federal supervision requirement and what that supervision language actually requires. As long as the federal supervision requirements remains in place, this confusion will continue. Again, the scope of practice for CRNAs, it's already been granted with House Bill 1198. This is a billing issue. Opting out and removing federal supervision aligns directly with full scope of practice legislation currently in Arkansas. This helps assist facilities across the state with continuing to meet the requirements for Medicaid and Medicare reimbursement programs while also growing, expanding, and retaining anesthesia providers across the state. Opting out will not change the standards of care or the safety of anesthesia delivered by CRNAs. More than 40 U.S. states do not require physician supervision of CRNAs within their nursing laws and rules. CRNAs are more than qualified to make independent judgments regarding all aspects of anesthesia care based on their education, licensure, and certification. Leading health policy journals have demonstrated CRNA safety record and found no evidence that physician anesthesiologists provide better anesthesia care. With safety not in question, let's talk about finances. The average salary for a physician anesthesiologist is more than double of an average CRNA. No wonder why CRNAs are the most cost-effective anesthesia provider. Up to date, 20 states have opted out of CMS's federal requirements for CRNA supervision. Of that, 2 states, Colorado and Utah, have partial opt-outs limited to critical access hospitals and specific rural hospitals. Arkansas needs to be the 21st. Today, CRNAs have full practice authority in every branch of the military and are the primary providers of anesthesia care to the U.S. military personnel on the front lines, Navy ships, and aircraft evacuation teams around the globe. If military surgeons trust CRNAs for battlefield anesthesia, Arkansas should too. At the height of the pandemic, the federal government suspended the CMS's physician supervision requirement for CRNAs. A number of states also suspended unnecessary supervisions. As a result, many CRNAs are practicing safely to the full extent of their education and experience, and many more patients can now get the care that they need. Governor Hutchinson, we ask that you continue to support CRNAs and state legislature, which supports full scope of practice for CRNAs. We ask that you notify CMS administration that Arkansas requests exemption from physician supervision of CRNAs in hospitals, critical access hospitals, and ambulatory surgical centers. With more than 50% of the U.S. anesthesia workforce, CRNAs have long been recognized for their specialized skills in airway management, intubation, advanced patient assessment, and excellent patient safety record. Yet, progress has been slow in allowing them full scope of practice. Governor Hutchinson, I plead to you, please opt out of federal supervision. With 2 nurse anesthesia programs in the state that will graduate a little over 50 CRNAs combined, we must increase efforts to recruit and retain our anesthesia personnel to increase access to anesthesia services and surgical services. Opting out will make Arkansas a more desirable place for CRNAs. Please use the references below.